So tonight's evening, we're actually going to do go through our website. We're going to actually explain to you why it's actually important for people to have a digital presence. We're going to actually go and give you examples of why it's important, because in terms of future, everything is now online. A lot more people do bookings online. A lot more people look for services online. So the main reason I think it's really important for people to actually invest in online presence is, first of all, you've got a lot of competition. You've got all the multiples. You've got people like Amazon. You've actually got digital website providers like Pharmacy2You that you need to actually be able to compete against. COVID-19 has seen a massive upsurge in number of people who are actually using digital services, particularly in terms of health. So you have probably noticed that most consultations that took place over COVID time was actually through a digital platform like AcuRx or EMIS, where doctors were actually using digital platforms to do consultations. It's a growing way of actually doing consultations. One of the key things that people do these days is when people want to look for services, when they want to buy products, they want to actually see what's available in terms of different types of products. Online is the first feature that people go to. Okay, so Amazon is a good example. So if you want to buy something, you will actually compare the different products that's on available out there. You want to compare the actual specifications of those products. At the same time, you want to actually see what the price is and what the actual availability of those products are like. What we're trying to design here is we're trying to help pharmacists to do that locally as well as nationally. So we're actually giving people a free web presence, which will allow you to, without investing any funding into it, to actually promote your services locally. So on an online basis, people know what you do, when you're open, what products and services you provide within the actual pharmacy itself. It also informs people about your opening times, your contact details. So rather than having lots of practice leaflets and cards and information leaflets that you actually have to hand out to people, you can actually guide them to your website, so that the website can actually allow them to find out when you open, when you close, what times you provide your services, and what times you're actually available to do those services. It also allows patients to directly book their appointments through you. Okay, to you through that platform. So you don't longer have to actually constantly rely on patients phoning up, booking appointments in diaries, trying to slot appointments in. If you start educating people to actually use your website, to actually book appointments for services, book appointments for things like follow-up services like NMSs, it'll make life easier for you, because you'll know in a diary when people are going to come in. You'll be able to organize your workload within your dispensing workload and any other bits and pieces that you do. Webline presence is really important in terms of commercial services as well as NHS services, because commercial services, people need to know what that service that you offer is, and then what actually involves in terms of booking that service and when that service is available to people. I'm going to actually introduce to Amish. Amish has actually got a lot of experience with commercial services. He's been doing private as well as NHS services for quite a while, and he's actually very successful in actually growing his business in terms of travel, in terms of aesthetics, and even things like blood testing. And he can actually explain why it's important for people to actually first think about generating income through private services, but at the same time, why it's important to actually use a web service that we've got at the moment to actually help manage their services. Amish, can I introduce you? And if you'd like to come on, thank you.
Thank you, Jimish. So as we all know, pharmacy profits are decreasing year on year. 5 years ago, if you were doing 10,000 items per month, you likely had a turnover of over £1 million. And assuming no loans, you could afford yourself, a second pharmacist, and still show a decent net profit. Now, fast forward to today, you will hear of many pharmacies being lucky to show a profit, many showing a loss, and those with loans or with high freehold rents, the situation is far worse. Many closures. We're back to pharmacy numbers of 5-6 years ago. We are currently in the midst of a 5-year flat contract, which in real terms is a decline of 2 to 5% year on year. Furthermore, MER services that were originally valued our time at roughly £1 per minute have been taken away and replaced with CPCS, where you will earn a third of the amount per minute and no guarantee of how many people you will see. With absolute certainty, people will be going out of business unless they find new sources of income through their pharmacies. So add to all of that, the threat of online pharmacies continually grows, as Jignesh mentioned. It was thought that services like CPCS would protect community pharmacy, but the truth is, with tech, there's nothing to stop remote consultations, as an example. GP is already doing it. And again, as Jignesh just mentioned, a lot of pharmacies even implemented some of those technologies during the COVID period using AccuRx and other software. So why consider private services? Counter sales and the currently commissioned NHS services will not make up for your loss of income. There's just no way it can do it. So by diversifying, you become less reliant on NHS income and gain better financial stability. With private services, I personally aim to earn a minimum of £200 per hour profit. This is more than enough to support an ACT, a full-time second pharmacist who can carry out most, or if not all, NHS services, and leave enough additional profit for survival and more. Private services will also give you a USP, give patients a reason to visit community pharmacy and not go online. Equally, not all pharmacies will deliver the same private services, as each will vary in skill and knowledge requirements. My advice in this respect is find a few private services that are of particular interest, specialize in them and become a master of them. Common private services that many pharmacies offer include sexual health clinics, hair loss, weight management, and travel clinics. These are most often delivered by a PGD. As Jignesh mentioned, some of the new and emerging services which I offer include remote health monitoring, private doctor services or in-house independent prescriber-led common ailment services, phlebotomy, blood testing, earwax removal, medical aesthetics, dermatology, the list goes on. It's also worth remembering that NHS services can help generate private income service as well. An example is with CPCS, where a patient might be seeking advice and help for a UTI. You can actually prescribe them antibiotic via a PGD or an in-house independent prescriber. It's important to remember to get your team involved with all of this as well. Your team will play a vital role in such conversions. It's important to have not only the right team in place, but ensure that they are well managed. Consider the use of ACTs, train the whole team well on what is effectively also link selling. So how can digital help manage and promote services? Now, before entering the realm of private services, I never actually realized how poor my own marketing really was. And I've been surprised after that to learn how many pharmacies don't even have an online presence. Posters and leaflets are everyday things, but how often do you change your own posters? How easy is it to change posters, considering it is what is effectively a paper-based system? Online marketing is essential this day and age, and that begins with a website. Through your site, you should be able to offer online booking functionality, capture patient data, and move towards a paperless working environment. It should also make it easy to provide information not only to your customers, but as a tool for yourself and for your team to get the information they need when talking to patients, when trying to make those conversions from NHS to private, or just promoting the private services altogether. From there, obviously consider things like Facebook, Google, and Instagram. You also now have WhatsApp for Business, where you can sell things, promote services, and push links for services direct to your website, for example. Now, Traveljab can actually help with providing many of these aspects, which I will now let Jignesh talk to you more about and show you how you can stand out from the crowd with just this bit of functionality.
So Traveljab has been created to make life easier for the whole team. So we initially started out with a travel-based or travel vaccination-based platform. The platform allows people, the public, to search for vaccinations by destination, so they can search wherever they're going. That information that they put in terms of the destination, the date they're traveling, and the length of time they're traveling, will then provide them information about what vaccines that they require for that particular destination they're going to. The postcode that they put in then allows them to check for any pharmacies that actually provide that vaccination service for them. and it actually helps them to compare the prices of those vaccines. That was the initial layout of the actual Traveljab platform itself. We've now refined it so that it's not just a national booking platform, but it can be now used as a localized booking platform, because every Traveljab partner now has their own booking platform and a web page. So once they create and register with us, that web page they create can be used to locally market. So that means that you're not competing against each other. You're actually using your own web page to sell your services locally, and actually book your appointments locally with that. So the key thing about this is it's actually speeds up in terms of the database that we have in terms of diseases and vaccinations for travel. It reduces your time, and it speeds up the booking time for patients. We've actually also created a flu toolkit. So during flu season, one of the key things is we miss out on patients which may be eligible, because we always focus on the over 50s or over 65s, but there's a group of patients which actually fall into at-risk groups. And a lot of patients don't know that they actually are eligible for flu. So our toolkit allows patients to self-assess whether they're actually eligible for a free flu vaccine. And if they are, they can then actually find the local pharmacy that provides a flu vaccine and actually book a service. They can also actually do that for private flu as well. So if they're not eligible, they can actually book a private flu through there. What we've also started to introduce within our booking platform is what they call a calendar. A calendar allows you to manage your appointments. So if you actually get an appointment booked in, and you find that you're not available, or you need to change that date, you can actually move the appointments around and actually make sure that you're actually able to actually inform patients accordingly. That allows us to manage appointments internally. We're going to actually add on features where you can do text reminders to pharmacists and patients. So again, that makes the actual communications process much more easier, rather than having to use the phone and email systems, where emails can sometimes get missed. What I've done with my particular pharmacy is that with the web page I've got, we created a QR code. The QR code can be used to promote your services to patients. So you can give them a credit card or a leaflet that tells them what services we provide, and then they scan the QR code and it goes straight to your web page, and then they can actually book or find out information about the pharmacy itself. We've recently introduced NHS services, and on top of the actual NHS flu service, which I'll talk to you more about once I've actually allowed Rina to talk about the importance of booking platforms and actually using the right tools to actually help manage a team. And then we'll actually go into a demo, and I'll explain more about the actual NHS services we do. Rina, I'd introduce you to come in and talk about NHS services, please.
No problems, Jignesh. Thanks for inviting me today. So I'm sure all of you have had like an absolutely crazy day today in your pharmacies, with the phone constantly ringing, people constantly coming in. We are just under so much pressure, aren't we, in pharmacies right now? And for me, last sort of September, October, November was probably one of the busiest times. I'm sure most of you did record numbers of flu vaccinations, and you were managing some sort of diary to do all of this. For me, it was a paper diary that I'd sort of very unassumingly bought a little A5 diary to book my flu jabs in. Soon had to change it to huge pieces of paper that we were making appointments in for patients for flu jabs. And at the time, I remember thinking there has to be a better way to do this. There has to be a digital solution. And I thought, I'm sure many of you were thinking the same thing, because you are, your phone lines are constantly tied up with people ringing to book appointments, and your staff managing receptionist tasks, really, that they're not trained to, we're not paying them to be receptionists, really, are we, and book people in. So for me, I think one of the reasons this is such an exciting concept and something that I think we should all be signing up to, it is because we need to think about having these digital solutions for our day-to-day services and things we provide, and having this obviously helps our teams to manage the patient expectation, it also helps patients to be able to book themselves without needing the use of our pharmacy team to answer a phone, for example. And I think those two things are really, really key. And I'd listened to Amish's presentation. I think he's absolutely right. We really do need to think about the private services because of our flat funding and all the various reasons that Amish mentioned. But also, I just want to remind everyone that it's really important that we do still provide those NHS services. The core of our contract at the moment is NHS, our dispensing and actually the 5-year funding, the 5-year contract, with the idea behind that 5-year contract was that slowly, we start to expand the range of clinical services that community pharmacies can offer. And we all know that we're perfectly capable of doing these services. We're highly trained medical, healthcare professionals, and we can do these services. And increasingly, I know a lot of my colleagues are just so swamped with the day-to-day that sometimes they let the NHS services slip. And I just wanted to kind of just remind everyone how important they are. One of the things that are, for example, the gateway for PQS. If you haven't done 20 NMS, you can't, claim for your PQS, for example. So this is showing just where the NHS is moving with NHS services, how NHS England's mind is working in terms of you being able to demonstrate the quality of your service, the quality of your pharmacy, and making sure that we really do take on board all the services that the NHS is sort of, providing us via the 5-year CPCF, and making sure we really do deliver on them. And to deliver on them, it's really hard, isn't it? Because we're just so swamped, it's so busy. It does feel like, we start one service and then suddenly there's something new we need to learn. So, we just did flu and we've all got really used to that. Now we're doing CPCS, and then we're doing hypertension service, and there's more services to come this year. It does feel like there's a lot on us. So somehow we need to do all of these things, but make it easy for ourselves. And that's where I think that digital presence of having that online, bookability by patients and by our own teams is a must do rather than a nice thing to do. I think it's really, really important, mainly to manage our precious time, but also to move away from those paper-based solutions. Like I said, for my A4 diary to now go away would be really lovely, and to have that solution is really, really important. And also it allows patients to book in. And sometimes I used to think, well, a lot of my patients are older, they're not going to know how to book online or do those sort of things. But as Jignesh said, COVID has changed everything. So even our parents are using WhatsApp and Zoom calls, and they're learning to do online shopping. So, and I recently created some social media sites on my pharmacy, and I was thinking it'd be the younger patients that use it, but actually it's a lot of my older patients who are constantly communicating with me on Facebook and on my Google pages and things like that. So it's really quite interesting how things have changed, and actually we need to move with those times, and we need to compete with the big companies out there, don't we, the bigger boys and girls out there, because actually if we're independents, we care, we do a really, really good job, and sometimes we do such a good job that we're a victim of our own success. And something like this, I think, is a really important way for us to show that we're moving with the times, and it also helps us to just be able to do more in our pharmacies. And I think, something Jignesh mentioned earlier that I wanted to just bring up is about those virtual consultations that GPs have been doing, obviously, since the COVID pandemic. There's nothing stopping us doing that. So, for example, you could, hire a pharmacist who does all your NMS virtually, and you could create a calendar on Traveljab for your pharmacist to book people in for their NMS, or your team to book people into those NMS calls. And that could be done virtually by a pharmacist sitting in their house that you pay remotely to help you with that NMS service. So we really need to start thinking outside the box and really using that digital presence to promote our NHS services. Happy to answer questions later as well.
Thank you, Rina. That's brilliant. Thank you. Okay, so I'm going to go through, do a demo in terms of the actual front, from the signing up to registration into the Traveljab platform to the functionality of the platform itself. So just to remind people that we are providing this platform to all people who actually sign up to it absolutely free. The only part that there is actually a fee involved is the actual private travel clinic, where we do charge £12 referral fee, but the majority of the platform itself is absolutely free in terms of the booking, the calendar, the access to information about destinations and the vaccinations that you require for those destinations itself, and the flu toolkit, which you'll find that once you start using that and actually promoting your flu service to the public using the platform, the public will know, people that normally don't come into flu because they don't know that they're eligible for it, like carers, care home workers, and so forth, will start using that platform to book in their appointments itself. So I'm going to actually demonstrate to you in terms of how to sign into the actual platform itself, then explain to you how the actual booking calendar itself works, and then I'll actually go on to how the public can use the platform to actually book services and actually get access to the actual platform itself. Okay, so let me come out of this. Right, so when you first register, you need to actually register with your email and create a password. And then once you've done that, it'll then take you on to the main logging in page. So it's really important that all your details are completed fully for your web page. When if anything's missing, you'll actually find that the content won't show up on your web page. It also helps us to approve your website much quicker. So if you actually fill all your details in correctly from the first moment you start registering onto the platform, and the fields are quite simple to fill in. It shouldn't take you more than 15 to 20 minutes to complete the whole actual process. So the first bit you would actually put in is your clinic details. That would actually, and it'll generate a specific Traveljab ID when you do that. So it'll be your email address, your telephone contact details, any websites you've got, your GPHC premises number. If you're a yellow fever center, we'd actually ask you to include that in as well. If you're not a yellow fever center, it doesn't really matter, just leave it blank. We then need the details of the actual place which is going to provide the vaccination. So some companies have several branches. If you've actually got the head office that's registering for you, we would actually need that address of the actual specific site that's going to provide the services or the actual vaccinations itself. We would then, you could actually add in features when people then use a web page, they will be able to identify who the people providing the services are. So whether the male, female pharmacists, what sort of languages that's spoken within the actual premise itself. So if you've got people who've got language barriers and they're actually looking for a specific pharmacy who speak Bengali or they speak Arabic or something like that, then they can actually find pharmacies accordingly. So at least that they're aware that your particular pharmacies have got people that they can talk to. So the times that you put into the vaccination opening times, okay, it doesn't have to match your opening times for your pharmacy. So if your clinics only run specific times at specific times during the week, so it could be 9:30 to 4 on Monday, 2 to 6 on a Tuesday, those are the times that you put into the actual platform here. Because then you don't want people trying to book in appointments when you're not available. You can also inform people in terms of whether there's parking, off-street parking, whether there's actually disability access, whether you've got transport links. So if you've got things like a station, a bus station, that can actually help people to actually navigate in terms of how they can get to the pharmacy. When you first sign up, there'll be a terms and conditions that everyone needs to agree to. And that the key parts of those terms and conditions are that, first of all, that you're actually registered with GPHC, you've got indemnity insurance, and you're actually qualified to provide the services that you're actually going to actually say that you're actually providing. So that way, liability-wise, that you're actually covered in terms of not being pulled up by GPHC, or if anything were to go wrong, your insurance company itself. So you need to declare that and you need to confirm that. Every time you complete a section, I would suggest that you actually save everything, because the last thing you want to do is you've forgotten to save something and then you have to start all over again. We ask for the detail of the owner. So it may, particularly it's about who, if it's a limited company, who the superintendent is, what the registration of the owner, details of the owner is. The owner could sometimes be different to the person who's providing the clinic. Okay, so it could be a pharmacist that you employed to do all your vaccinations, or whether it's your, as Arena said, your CPCS and consultation services. We'll also actually ask you to put in an email address that's going to be accessible to every member of staff member in the pharmacy, because last thing you want to do is you have to miss all those appointments that's coming through and that's been booked. I normally tend to use my shared NHS Net email account, because that's always on, because we're actually now getting used to having all our referrals come through that. So this way it's easier for staff members to identify that there is a booking that's come through. And we would also use the mobile number of the key person who will actually be managing the appointments. So at least if when we start using the mobile facilities, it's actually, you've got two messages that comes through. You've got the mobile as well as the email message that allows us to make sure that appointments are not missed. If you're an NPA member, we ask you to actually put your NPA details in. And if you've actually belonged to any other buying groups, we ask you to actually include those bits and pieces in as well. Once you've completed all of this, then you actually just need you to agree that you've agreed to the terms and conditions and say save again. Then we'd ask people if they can to actually opt in to actually getting messages from us. So that allows us to send you any updates on any of the software that we're doing. It gives us information on any market changes. It also helps us promote ways of actually using the actual booking platform more efficiently, so that we can actually continuously engage with you, so that we can actually help you to actually use the platform and get the maximum out of it. So once you've actually filled in your details, we then get you to fill in information about the services that you want to provide. So if you're a travel clinic or if you provide private vaccinations, we would actually get you to say whether you actually provide those vaccines and the actual price of those vaccines. We do provide a guidance in terms of what the average prices are for each vaccine that we're actually provide. So it then gives you one of the common questions I normally get when people are signing up to is, what should I charge? What's the best price to charge for hepatitis A or typhoid or yellow fever? Unfortunately, because of competition law, we can't get everyone to use the same price. So we have to give them a guidance in terms of what the ranges are, the average, and then people can choose the price that they want to use. We've got specialty vaccines for pediatrics, or anyone who provides pediatric vaccinations. They can actually select and say that they provide children's vaccines. We've got specialty vaccines like chickenpox, HPV, meningitis B, shingles. And then the most common feature that occurs during the winter season, and one of the biggest bookings we get, is the actual flu vaccinations. It's a toolkit that actually really has helped us in terms of actually getting more appointments coming through. We've actually had a lot of private vaccinations come through as well. So because if people know what prices they're paying, we've got disease leaflets. We've linked up the actual flu service with a specific disease leaflet on flu, which talks about what flu is, what the symptoms are, and what the risks to people are. And with on our COVID page, we've actually talked about flu and COVID and the risk of that. And that's actually improved our uptake of flu itself. So the most recent stuff that we've actually added on to our website is this NHS services. And this is where I think this platform is going to be really useful for people to manage their day-to-day appointments and the day-to-day way of actually managing the workflow. So they can start selecting times and they can provide these services. So if they're going to be doing, let's say, CPCS and hypertension clinics and only in the afternoon, because they've only got an additional member of staff or an additional pharmacist who is part-time, they can start selecting those times and actually specifically saying what services they want to provide at that time. So things like CPCS, I know that it's actually normally a referral that occurs from either 111 or GP. But the key thing is you still need to actually engage with that patient. So you need that patient to come in or have a chat with you. So if you've actually got a busy pharmacy, you can actually get a member of staff to say to the actual patients, look, you've been actually referred to this service. Pharmacist needs to talk to you. there are some slots that's available to you. Do you want to book a slot between time A to B? And then you then actually book that appointment, and then you've actually got a specific time that you could contact that patient, and the patient knows when he's available. Because what normally used to happen before I had this is I used to phone up the patient 3 or 4 times to try and catch him when he's free before I could actually do the CPCS service. This way, if you can manage that time, then you know your workflow you can manage on a day-to-day basis. You know what you're going to be doing, and you know what times you're going to be actually providing the clinics itself. So once everything is complete, and then once the site is approved, once most of the information is actually terms and conditions and information from the key information is fully completed by you, within 48 hours, we then create a specific web page for you. And each web page has a specific URL address to it. So this is the URL address that you would use to promote your particular pharmacy. And you can actually create, like I said, a QR code for that URL address. So an example is my pharmacy, and I hope this is not playing games on me. Okay, so this is what you would see when you actually, once your web page is created. So it gives information about the pharmacy, the languages that's spoken, the contact time, and opening hours, okay, or clinic opening hours, I would say, because if you're not providing services all throughout the day, then those hours could be different to your normal opening hours. So this is the key feature about the services that we actually provide, and it's the services that people can book and book into. So with the NHS services, patient can select what service they want. They would click on it, they would put in the postcode, and when you find clinic, then they'll be able to book an appointment in. The difference between the main Traveljab website and your personal web page is any bookings that occur through your web page will only go to your pharmacy. It won't go to the whole, they won't be able to select other pharmacies. Whereas if you go to the main web page, when they put that postcode in, they might get a list of 40 or 50 odd pharmacies that they can choose from. So this is the thing that I'm talking about, is local web page, local promotion. So when you've ticked all your information, your prices would be visible to the actual patient. So they'll be able to see what prices you charge for the individual vaccines. Patients will be able to see a brief description of the actual vaccines that they want to actually get. They can get a more detailed information about the actual condition itself. So this is where, in terms of when you look at things like fit for travel, when you look at things like NatNec and Travel Health Pro, it's a bit more difficult to interpret. For Joe public, it's very difficult to actually interpret the information. We've simplified things. So when a person doesn't understand what that disease is and why they might need to take that vaccine, this information may encourage them to actually make that decision. So it's a toolkit for them to actually look at before they can make a decision in terms of what vaccines they're going to actually have during the consultation itself. So, same with flu. You've got the information about the prices and what the condition is. So as I was saying, that we've got specific information about flu itself and what flu is and how it's spread, and the complications of flu and why they should actually have flu vaccinations done. So we're trying to actually educate the public, but at the same time, make it easier for them to book an appointment and actually make it easier for pharmacists to manage the day-to-day running of the pharmacy using that platform. So for me, like I've already put up all the NHS services. And again, it gives patients a bit more information about the services we provide. I haven't actually gone into detail about the specific services at the moment, because most of these services are still pilot stage, and there are actually quite a lot of changes that's occurring at NHS England level. Until that gets totally ironed out, we will have the same level of information about the services as we've got for the vaccinations. And that will encourage more patients to actually take up the services and to actually book appointments with pharmacies. I've actually left out the flu toolkit. So if I go through the flu toolkit as well, so if the person was to click on whether they're in England, whether in Scotland or Wales, they were then able to decide if they're eligible for a flu vaccine by actually just going and clicking on various boxes. So if they're over 50, they click yes, they'll be able to go straight to the booking page and book an appointment. If they're not, they'll go into the next part of the actual toolkit, which will tell them all the conditions that allows them to get a free flu vaccine. So again, if they think that they actually are eligible, they click yes, and they go and actually book an appointment. I've got a specific bit on things like carers. I've separated all that out because sometimes people don't know that if they're a carer, if they look after someone, if they work in a residential home, if they're frontline staff, that they're eligible for a free flu vaccine. So again, that allows people to actually book into that. For London, we've actually also got the specific bit for the London SLA, the service level agreement, where then they can actually look at which group of people that work within London are eligible for the actual free flu vaccination as well. If they're not eligible, they can then actually book the vaccine as a private vaccine. So that still gets them to book the appointment, even if they're not eligible as on a free vaccine. So the toolkit just allows them to decide whether it's something that they can get free or something that they can book in if they want to. Okay, is there anything that I've left out? Yeah, so the booking process is very simple. Okay, so I'm going to now go back to the booking platform itself. So what would normally happen is once a booking is made, you would actually have a calendar. So within that calendar, so most of these patients these are all actually dummy patients at the moment. So in terms of data protections, they're actually not live patients. So we've got no worries about data protection here. So each day you'll see how many appointments have actually been booked in. So if you actually click on that appointment, it'll tell you who the person is. It'll give you their contact details. So if you need to get in touch with them and say, look, you know what, I need to reschedule the appointment. I'm not available, or these vaccines are not available at the moment. There's a shortage of it. I know you've got a let's say, yellow fever vaccine, and then we need to reschedule, or we can help cancel this appointment because you're not actually able to do this at the moment. So you can actually see all the appointments come up, and you can reschedule and move them around if you're not actually able to do that clinic at the time it's actually been booked in for. You also got a view which is known as the list view. So it just gives you a full list of all the actual bookings that's occurred. And within that, it'll tell you what services that's been booked in, and the date of the appointment itself. And then if you click on details, it'll tell you, whether it's actually, if it's an NHS service, it'll be 0. But if it's actually a private service, the cost, and then the fee that we're charging them, and what they expect to pay for the remaining vaccines. So if it's something like a typhoid vaccine, if typhoid vaccine costs £35, we're taking £12, and they expect to pay the actual pharmacy the remaining amount. So that's how the booking calendar works. And like I said, we can reschedule the appointment if you can't actually provide the service. So we've made it as easy to use as possible. It's very, very easy to maneuver around the actual front and back end. And there are lots of development stuff that's happening at the moment. So we're constantly working on this, and as more people come on, more feedback we get on, we will try and actually further streamline this so that it works for them. The whole idea is to actually, this free booking platform should actually make their workflow much easier. It should make it easier for patients to actually navigate around the website and actually book appointments. And I think we're doing a pretty good job here. Your opinion is what will actually show us that, we are doing a good job or not. Okay, so that is the web page. Okay, so reasons why I think we should actually get people to sign up to us. So first of all, I think, and Amish can actually tell you how much money he's probably spent on his website to actually, do all the actual booking and promotion and everything else he does. It's a costly exercise, and actually so there are lots of website companies there, okay, but getting the right website and actually making it look good, making it easy to flow and make it work well, it's not that easy, unless you have some technical background and you know how to actually create a website that works for you. So what we've done is we've done majority of that work. We've actually created a platform which is, like I said, easy to use, easy to maneuver around, and it's something that pharmacists and patients would actually love to use once they get used to it. Key thing is not everyone can afford a website. So if they don't do enough services, is it worth investing in a big website? If not, then we've got the solution for them. So from the NPA and us, we're actually giving them a toolkit and a website that they can use without investing any money into it. It's free. So for me, I would say to people, why wouldn't they invest in a website that doesn't cost them anything? Okay, even a booking platform that doesn't cost them anything. So not having to use a diary and actually doing things online, it really makes a life a lot easier. It's something that I would say, it's worth considering. But I think the one thing that you really need to think about, and I think you need to reflect about, is the last 2 years, okay? More and more businesses actually gone online. More and more, face-to-face retail outlets have closed down. Debenhams is a typical example. They've had no choice. They had to actually move towards online and actually use online services to actually continue their services. People are now getting used to using online services. I think the biggest growth that has occurred, and the people are actually expecting that most industries, pharmacy, whether it's GP practices or whether retail outlets, that they expect that there is some sort of an online way of communicating. Okay, and the people that's actually controlling what happens in the online business is Amazon, Just Eat, Deliveroo, and Uber. They've seen the biggest growth ever in the last 2 years. Okay, and I think that people expect people to have something online to be able to access services. And that this is the main reason I think that people should join us. I believe in that, I believe that, our vision as Traveljab owners, we want our partners to have a unique platform which not only actually gives them a digitally enhanced image of their pharmacy, because that's really important now, but it actually also provides access and lets people know what services that you provide without having to use a lot of posters, without having to use lots of campaigns in terms of postal campaigns, having to do door-to-door leaflet drops and so forth. I think our platform will provide a lot of solutions for a lot of people. And I now leave it to the floor. If there are any questions, we will be more than happy to answer. Thank you.
Hi, Jignesh, it's Ashley again. We've had a few questions come through on the Q&A.
Okay.
I'll just read the first one to you. It says, who can see all the information held on the site, as appointments and bookings will have names and telephone numbers? Also, are we assured that none of this information will be shared with marketing groups?
Okay, so first of all, as the owner of the website says, we would be able to see that information, but that will not be shared with anyone at all. the information is there just to make sure that everything is running smoothly. So if a patient actually has issues in terms of whether pharmacist picked up an appointment, or if a pharmacy still provides a service, then we can use that information to get back to the patient. So we're just trying to make the flow for customers as smooth and easy as possible. Initially, when people join up, we do actually follow pharmacists up to see that they've received the appointment, they can see the appointment, they're able to actually access and see their records. So if there's any changes that needs to be made, they can actually get in touch with the patients on time. So yes, we see that information, but it's to actually improve logistics and actually make sure that we're able to actually make service, both ends meet up as smoothly as possible. But there is no way that any of the information will be shared with anyone else. It's all for the actual organization to use to actually support the actual service development that we've got.
Great, thanks. The next question is there a private PGD service tab?
Not at the moment. So we're actually, as time goes on, we're actually building on the range of services we provide. So the main PGD service that we're actually got is the travel clinic. So all the vaccines and so forth is actually, so at the moment, all we do is it's just a booking platform. So we only refer people to the actual pharmacies, and pharmacies or patients to find pharmacies that provide particular services. So PGDs and everything else is actually a separate service that the pharmacists would have to actually use. So if they've got a platform that they need, it's a PGD provider platform that they'll have to use to actually see, what protocols they have to follow, and then what sort of PGD inclusion exclusion criteria they have to follow. So we're trying to keep our system as minimal as possible. So basically, it's an information platform. So we don't want to get involved in the clinical aspects of the actual services that we provide.
Okay. Everyone's quite interested in the reference, the fee, the £12 fee. Can you explain more about that?
Okay, so if someone were to actually come in and say that they want to go to a country like Ghana, or wanted to go to places where the vaccinations are required, once the patient has actually identified that a pharmacy that they want to go to, then the patient would pay us £12. So that's a booking fee. Once the patient comes to the pharmacy, if they have any vaccinations or if they have any antimalarials, the pharmacist would then actually deduct £12 from the final fee. So that £12 is actually what they call a referral fee, where instead of we charging back the pharmacy, we're actually getting the pharmacist to reduce the actual amount of the final fee. We've actually tried to minimize in terms of how much this site would cost patients. So if you look at our competitors, some competitors have what they call a subscription fee, called a heavy subscription fee. They have 15% of the actual charge for each vaccination or each service that actually booked for that system itself. Ours is a flat £12 referral fee. And if that patient were to come back to you after the initial referral, so let's say you have rabies and you have to go back for 3 appointments, you will be only charged the initial £12. You won't be charged for any multiple visits. So it's just the initial introduction to your pharmacy from us.
Okay. One of the questions here is that if you already have a website, how can it be linked to Traveljab? Or if you're in the process of creating a website, is it still worth continuing on your own website, or should you now be looking at the Traveljab system?
So we can integrate the website into, so you can use your URL code that you've got that can be incorporated into your website. So that for myself, I've actually done the same thing. I've actually got my own pharmacy website, and I've actually added the URL code into my pharmacy website. So when it comes to travel, instead of having to create your own pages for travel, you could actually then just get the patient to click on that URL code, and then they'll be able to do all of the process in terms of bookings and so forth. So most websites that are created, the small commercial websites that without the actual commercial bits for selling online, won't have a full booking facility on there. So you might get emails. You might say someone wants to actually come in for a test or some sort of a service, but it's not a full booking calendar or a booking platform. What this will help you do, as soon as you actually put your URL code into your website, you can use the booking platform to manage your services. You see, and then that's actually the beauty of our website. And then that the whole platform is free. So you're not paying to actually incorporate that booking platform onto your site.
So just to clarify, that can be incorporated into your pharmacy website, and that booking platform is free.
Yeah,
right.
That's great.
Okay. I mean, somebody's asked how Traveljab is related to the NPA. I mean, obviously you're one of our valued business partners, and obviously the NPA works with business partners to support community pharmacy. So that's that one. There is a question regarding flu. Can patient access pharma outcome platform QR code to fill the consent form in? This will saves us trying to put in most of the patient detail.
Again, unfortunately, because we don't have the clinical facilities and so forth, and things like forms and stuff like that, they won't be able to do that. But you tend to find from this year onwards, or for the last couple of years, most of the written consent and form filling has actually gone. So in terms of if you're actually using Sonar or Farm Outcomes, long as you get the NHS number, the date of birth, and the name of the patient, you can actually pre-populate the information directly onto the platform itself. When the patient comes in, all you need to do is confirm, and then say that there's a verbal consent that's been actually taken from the patient, and then you do your vaccination. So you really don't need the actual form filling that needs to be actually linked up with the actual toolkit itself. So all you need to do is that the patient needs to book. And then when that booking occurs, you've got the details, so you can pre-populate things before the patient walks in.
Okay. And it seems we have sort of one more question, unless anyone else would like to ask anything. It says, can the vaccine records be sent to the GP surgeries?
Again, we don't keep those records. So we're just a booking platform actually referring patients to you. So any clinical bits that you do at the moment is something that you keep for your pharmacy. So again, it's all about this data protection, having information about clinical conditions about patients and so forth. So we're currently staying away from that. All we want to do is inform people about the services that's available within the pharmacies, and then how they can actually access those services. So we really don't get involved into the clinical aspects of record keeping and sharing. That's something that pharmacy would still have to do.
Perfect. Thanks, Jagnus. I don't seem to have any more questions coming in. I will just wait a couple of seconds in case anyone has any last minute things. But again, if anyone does have any further questions, your contact details are on this presentation, which we will be sharing with the attendees tomorrow. So I'm sure you're happy to answer any further questions you might get from that.
Definitely.
Right. So no, that looks good. That will be us for this evening. Thank you so much for taking time out of your busy days. Jignesh, Amish, and Rena, thank you so much for joining us this evening. And we look forward to seeing you again at our next webinar. Take care. Thank you.
Thank you, everyone.
Great.
Thanks. Bye.